I'm going to mute, please everyone mute your
Where's my folder?
audio.
Okay, you can go on.
All right.
So guys, we're live now. Kingsley, very quickly. So you just return yourself back as hosts, and let me be co-host because I might not be available through the meeting.
You're the one that will do that. Please do that.
Okay.
Okay. Can we start? Are we ready?
Yeah, you can.
Okay. Hello, everyone. Good afternoon or good day from wherever you are. My name is Stefia Imoisi, and we'll be having our webinar today. So this webinar is organized by Connected Development. And for those of us that do not know, Connected Development is an NGO that's with a mission to empower marginalized community. So we have a vision to, make sure that people, even those in rural communities, can have access to information. We have a Follow the Money project. So the Follow the Money initiative basically is to hold government to account. And we want government to be more transparent, to be more accountable to government funds. Today, we'll be talking about the COVID-19 intervention funds and donations. I mean, we all know what COVID-19 entails. It's a global pandemic, that even caused the world to shut down. It has affected and even led to deaths of so many persons. And we can see the numbers increasing on a daily basis. So I'm not even going to dive into the whole COVID-19 precautionary measures and all that, but they are laid down measures put together by the WHO, NCDC, for those of us in Nigeria, to try to curb the spread of COVID-19. And we've also seen the government put in so many measures. I mean, we know that the government are trying to develop a vaccine to be able to stop or reduce the spread of COVID-19 in Nigeria, and not just Nigerian government now, in the world. This Facebook Live is sponsored by ActionAid Nigeria to help track COVID-19 funds in Nigeria. Right, so I'm not alone, and before I go on and say the whole story about COVID-19 and what led us to start this project, I would like to call on Blessing from ActionAid to give us her opening remarks before I introduce other persons on this Facebook Live. Blessing, over to you. Blessing. So I'll leave Blessing to introduce herself. Blessing works with ActionAid Nigeria. She's actually the project lead from ActionAid end. And yeah, so she's going to tell us, what the project entails, what we need to look out for, and all that information. Blessing, please. Okay, so while we're waiting for Blessing to come on, let me just go into details in telling us what the project is about. The project is organized to engage young people from all walks of life in order to hold, to design a strategy to hold government to account. And accountability is all about taking up responsibility. And then the government have chosen to lead us. Most people have donated to curbing or trying to help COVID-19 patients in Nigeria. So basically what we're asking for is the government should provide this COVID-19 intervention funds, put it on, accessible platforms so that people, anybody can be able to access this information. So we want to be able to see income, whatever is coming into the government purse, and then we want to be able to see expenditure. So that's what accountability entails, basically. We should be able to track funds going in for COVID-19 projects and funds going out for the use of COVID, to curb the spread or help people that really need these funds during this era, this COVID-19 period. So we've been able to map out 6 states. So we chose 6 states from the 6 geopolitical zones in Nigeria to help us monitor the COVID-19 intervention funds. Blessing, if you're ready, just let me know so that I can pause, and then I'm actually trying to wait for you with this. So if you're ready, just let me know in the comment section, and then you can go on. So back to what the project is about. The 6 states that we've been able to map out are Borno State, Kaduna State, Abuja, Lagos, Enugu, and Akwa Ibom. So we have state leads or state champions in these states, and they are with me here. We'll be listening to them, hearing from them what they've been able to do so far on the project, how they've been able to track COVID-19 funds and interventions in their states, and how they've been able to, and we'll also be hearing how they've been able to engage governments and even young people. Like I said, this Facebook Live is targeted at young people to develop strategy on how to monitor or improve accountability of public funds, especially COVID-19 funds. So later on, I'll be engaging them, and they are my panelists today. I'll be engaging them, and they'll try to tell us more about what they've been able to do. I know some of what they've been able to do is to organize a tweet chat, which held sometime this week, for the different states. They've been able to organize tweet chats where they've engaged government officials that on Twitter, young people, just to engage them, passing out information, hearing from people, know what they've been able to do around the COVID-19 intervention front. Blessing, if you are there, let me know so that we can move on to you for your opening remarks. Hello? Okay, so while we're still waiting for Blessing, like I said, the theme of today's discussion is COVID-19 intervention and gender responsive public service in Nigeria. Before I came on, someone asked me, why do we have when I start discussing with the panelists, I'm going to bring that on. But someone asked me, why do we have so the panelists are not balanced. We have just one female, apart from me, the moderator, and then the others are male, But when we get there, we'll be able to hear why, gender inclusion, gender responsiveness in public service delivery. Blessing, over to you. Hello, Blessing. Hello, Blessing, are you there? Okay, while we are waiting. So while we are waiting for Blessing, I think we'll just move on, pending when Blessing is able to come in, right? Okay, So let's just move on. Let me take you through the program for today's event. We don't intend to waste anybody's time. We would go straight to the point. And this is a plea to the panelists.
I can hear you.
Blessing, are you there?
Hello?
Oh, Blessing, good to have you.
What is happening?
Can you hear me?
What is that? Hello?
Yeah, Blessing, I can hear you. I think we can all hear you. Just let me know what your challenge is so that we can assist you.
Hello?
I can hear you, Blessing. Go on.
What is happening?
Okay, so while Blessing is trying to sort out her technical issues, let's just go through the program for today's event. Today's live show, like I said, is organized by Connected Development. We are trying to track or uphold accountability around the COVID-19 donations and interventions. We are just pleading or telling the government to provide a platform. It can be on the websites, online, so that accessible platforms where people can reach to get COVID-19 intervention funds, and then we'll be able to track these funds effectively and then see how these funds have been judiciously used for the said project it was meant for. So basically, in summary, that's what we're here to do. We were supposed to have the opening remarks by Blessing. Blessing is the project lead from Action Aid, and she was supposed to, give us the opening remarks and tell us a little bit more about the project. But I guess she's having technical issues. We'll just move straight to the next item. The next item is the panelist discussion, right? So the next item is the panelist discussion. I'll be calling on the panelists, to tell us their perspective on the project. They were engaged sometime in April to track funds meant for COVID-19 projects. And the whole idea, like I said, is create that awareness, make sure that the government put information out there so that we can see the inflow and the outflow. As a finance person, I'll call it inflow and outflow. I mean, that's what it is. So yeah, we'll just go straight to the panel discussion, and it's going to take place in this manner. Each of us, please, 5 minutes, because we don't have time and we have to stick to time. I'll be timing us, please. 5 minutes, you tell us, you speak on COVID-19 donations and interventions in your respective states as it relates to your state, because I know you've been tracking or following up on the project since. So you tell us, as it relates to your state, let us know those issues you've encountered. Let us know what has been happening in your state. And then you also talk about how gender responsive the public service has been in this pandemic. So we need to know all this. Okay, Blessing is asking to come in. All right. So we need to know as it relates to your state. And that's why we have all our state leads here. And like I said before, people reached out to me asking me why we have more male than female on the panel discussion. And then really, so when we talk about gender inclusion, right, it is, yes, we're fighting for all gender to be included. You don't carry one person along or one party along and leave the other party. The whole idea is not, so once it's a gender campaign, it doesn't mean only females should champion that campaign. You can have men. I mean, we've had so many cases where the male champion campaigns. Okay, I can see Blessing coming in. Okay, as I was saying, we have instances where we see male championing gender inclusion or female inclusion campaigns all over the world. So why we have more male is because these people on the panel discussion today are our state leads in the different states. So they help to channel, the conversation, like I explained earlier. Blessing, are you ready for me? Oh.
Yes. Hello?
Yeah, I can hear you now.
Yes.
Finally. So you just take us through your opening remarks very quickly because time is far spent.
Okay. Sorry about the delay. I didn't know what happened. I was online earlier, but I couldn't hear anything. Sorry about that. So hello everyone. My name is Blessing Ifemena. I work for Action Aid Nigeria. I've been given the opportunity to just say a few things. So let me quickly say, because our time is fast spent. Action Aid Nigeria is an affiliate of Action Aid International, and we're a feminist organization. We work to promote the rights of women and girls and also young people. And we prioritize working with young people, which is very key to our work. So basically, the work we are doing that led to this webinar we are holding today is one of the projects we are running in 6 states, youth organizing and leadership project that we are implementing in 6 states of Akwa Ibom, Enugu, Borno, Lagos, Kaduna, and the FCT, 6 states across the Federation. So the idea behind the project is we want to mobilize young people to take actions to influence public finance and government actions around public finance and gender responsive public service. So this is what has been happening. As I heard Steffi mentioned about gender. Yes, when you hear about gender responsive public service, it's not only about women, because gender is for about everyone, all genders, both male and female. So what we are doing through this project is to ensure that the voices of young people are being projected, their voices are heard, so that they'll be able to take actions in their various states and also, in fact, across the nation to influence public opinions and government actions. As you know that half of the population of young people in Nigeria are young people. So we can't just keep quiet. When it comes to education, it comes to health, we are the most affected, even in unemployment. So that is what this project tends to do. So back to the work we are doing with CODE, Connected Development. Since the onset of COVID-19, a lot of donations has come in from government, from private individuals. If across the nation, people are donating in the fight against COVID-19, that is the COVID fund we are talking about. So this is part of the accountability process. What do we want to do? We want to see that resources are being redistributed so that everybody will have access to resources. As a lot of resources are coming in, how do we engage? How do we keep decision makers, government on their toes to ensure that these resources get to the right people? So that is basically what we're doing. And you know that public accountability can only be made possible in a system that is transparent. So all the funds that are coming in, we need to know where are they going, who is getting who gets who. If you say you are distributing palliative, how many people are getting? How do you get your numbers? So this is basically what we want to do. And also for young people, to drive this conversation of public finance expenditure and tracking. So you are welcome to this section, and I want everybody to feel free to open up and listen to what the state lead have been collecting data. Actually, the data have been collected from the 6 states. So this is an opportunity for young people to join the conversation. A lot of things has happened. So I want everybody to please listen attentively and also make your contribution so that what is due for us will be able to know for each state what has come into your state and how you're able to track and to ensure that these funds are not diverted to other things. Thank you very much. Thank you, Stefia.
Thank you so much, Blessing. Thank you so much. Like she said, we want to track funds meant for COVID-19 intervention. So yes, that's what we are doing today. We want to engage young people, like I said earlier, to track. We've engaged state leads, like she mentioned, 6 state leads that will be sharing with us today their perspective, what has been happening in their states. So when I call on a state lead, please, you quickly introduce yourself and then you tell us what is happening in your state as regards COVID-19 donations and, publicizing of this data. And then you tell us how gender responsive the public service delivery in Nigeria is. So quickly, in 5 minutes, please just take us through all of this. So for our viewers watching us on Facebook Live, you can join in this conversation by asking your questions. Leave a comment on the chat box or your comment box and tell us, share your own perspective. We also want to hear from you, our viewers, our audience. What is happening in your state? Give us experiences, comments, questions, whatever, share with us so that we hear what is happening in your states or generally. Ask questions. That's why we have, so immediately after the panel discussion, we'll be going straight to Q&A where we would hear your questions. So please do not wait for Q&A, just leave your comments or your questions in the comment box and then I'll pick it up from there and I ask our panelists. Thank you so much, guys. So panelists, I hope we are ready. Okay, I'll move straight to Zeliha as my fellow female on this and blessing too. Okay, so I'll move straight to Zeliha. Tell us, Zeliha is our state lead from Kaduna State. So she'll quickly tell us what is happening in Kaduna State as regards COVID-19 donations and intervention. Zeliha, please.
Good afternoon, everyone. My name is Zeliha Lawa, and I manage the activities of Connected Development and Follow the Money here in Kaduna State. So in Kaduna State, when it comes to issues around COVID-19 funds transparency, I must appreciate the so far they're able to publish online in digital platforms on funds received so far, donations on materials and other relief materials received so far, and also how these donations or this money are going to be spent. Kaduna State has those information online, and we must give kudos to them because they're signatory to the OGP and also the OCDC, that's Open Procurement Data Standard. And so far in Kaduna State, there's a sum of 500 million that was donated by the principal officers. They donated this money, and what they use the money for is to get palliatives such as foods and other relief materials for vulnerable people. So initially they had it distribution in 8 local governments, which were the pilot local governments. And what we realized during that was there was no really transparency when it has to do with distribution. When it came to distribution, the people that distributed had issues with the issues from different local government areas. So what the state government did was that each community would give 7 people. There was a committee inaugurated made of 7 members, whereby they had religious leaders, traditional leaders, youth groups, civil society organization within that community and the rest. So these committee were charged with the responsibility of selecting 1,000 people per clusters that they believe are vulnerable. So the definition of vulnerable people are people that are very poor, women, widows, and those were like the definition of vulnerable people. But we realized that some of these committees never abided by the stated procedure for distribution. So at the end of the day, palliative that was meant for just a household, a family, that would maybe keep them for a month, was distributed among other people, because the community felt that it's government property, we should all partake and share the loot. So we had that issue during the first distribution, but the second distribution, we had more transparency. The government were more responsive to the challenge, because during the first distribution, they never engaged the civil society people, but during the second distribution for the other local government areas, we had civil society organization monitoring the process, and it shows that there was a level of transparency and accountability at that state. So when it comes to issues around gender responsiveness during this period, we can see that the government is a bit slow on issues around public service delivery, because focus has been shifted to COVID-19, and everyone is talking about COVID-19, how to build isolation centers, issues around education, health. We are lagging behind, and it has really affected a whole lot of young people. We've seen the increase in cybercrime, we've seen increase in sexual assault at this period. It shows that most of these young people are not actively engaged, and we know that an idle mind, they say the devil's workshop. So for governments, we feel that they've not been responsive enough, and they should do better. But we should also recognize that for secondary schools in Kaduna State, most especially senior secondary schools, the government set up a sort of learning at home program using the radio and television, whereby most especially SS3 students listen and watch tutorials. They have timetables on all subjects taught. Also, we've seen, I think, on 18th of this month, the Commissioner of Health posted on Twitter where she talked about issues of sexual assault that has been reported so far in the state, and about 108 is presently in courts. So it shows that to some extent we've seen issues around justice, and also the punishment is a life imprisonment for anybody found guilty of any sort of sexual assault, like rape, for instance. But nonetheless, the government still needs to do better when it comes to gender responsiveness, and most especially on public service delivery. We know that post-COVID, things are going to be very different. Things might be difficult. What is government doing presently to ensure that post-COVID, things are made easier? The young people can contribute to the society. The young people can help build back the economy. We know that United Nations Security Council, through their resolution, have given situations whereby young people can rehabilitate and also restructure the economy post-conflict or post-COVID. COVID is also a sort of crisis. So what is the government doing to ensure that young people are actively engaged now, to ensure that post-COVID, we grow the economy back to what used to be, or better than it used to be? So these are things that we think government should also look at. It's very important. And also another thing that happened during the COVID was that there's a program called Click on Kaduna Entrepreneurship Program, and it happened last year. And part of the, it's for young people, whereby they train young people on digital skills, entrepreneurship, and using digital tools. So during this period, the those that did so well, I think the 30 best or 40 best were given a grant of 350,000 naira with support from World Bank. So it shows that to some extent they are doing, but we still need to do more as governments, because the youth are the leaders of tomorrow, so they say, but we believe that the youth are the leaders of today. We are the ones that can make Nigeria better, and we need to be actively engaged to do so. So far, we had in Kaduna State, we had our tweet chats 2 days back, and one of the outcomes of the tweet chat was because we engaged the government in the process, and one of the outcomes was immediately after the tweet chat, the government, the governor's handle tweeted that henceforth the Kaduna State government would not be deducting money from the principal officers' salaries or receiving any sort of cash donations, because they lifted the lockdown so that economic activity can strike. So probably the tracking of COVID-19 might not be as we expect in Kaduna State, because the government are saying that they will not be needing any funds from anybody henceforth. But nonetheless, we still need to have a framework. We still need a framework in Kaduna State whereby civil society people can easily track emergency procurement funds. Thank you. I think, yeah, that's all I have for now. Stefia, thank you.
Thank you so much, Zaliha. Thank you so much. Wow, that was very enlightening. I mean, she talked about, so she mentioned OGP, and I would like to say that the full meaning of OGP is Open Government Partnership. So that for those of us that do not know that, yeah, she also mentioned the Kaduna Entrepreneurship Program, which the Kaduna State they've engaged in, which is very impressive. Thank you so much, Zeliha. That was wonderful. So quickly, because we do not have time again, I'll move straight to Tosin from Lagos. Tosin, please introduce yourself and tell us what's happening as regards COVID-19 intervention in your state.
Okay, good afternoon, everyone. My name is Additional Tosin. I'm the Lagos State Chapter Lead of Connect Development Follow the Money. And I want to welcome you all to this discourse. As you all know, Lagos is the epicenter of COVID-19 in the country. The first case was detected here. And even before detection, the state government, under the leadership of Governor Sanwo-Olu, has put in a lot of structures and a lot of things in place to make sure that the virus could be contained, even though it is suspected that it's going to spread due to human behaviors. So the government has been working that. However, going to the main cross of our discussion, which is on tracking COVID-19 fund, Lagos State government opened an account where they used to collect donations in kind in cash. And the state government have given us updates. And those are the updates that even we have fraud money, we have those updates with us. They've been able to publish the updates of amounts donated, okay? The ones that came in cash, the ones that came in kind, they update it from time to time. And also what they've actually done again is that they've made this thing so open to an extent, because Lagos is quite opaque when it comes to finances, but on COVID-19, they've been quite open. They've told us the number of money that they've received, the number of donations in kind. A lot of people have built isolation centers in Lagos State. People have donated materials, face masks. People have donated food stuff, among others. Now, concerning the COVID-19 palliative fund, palliative distribution in Lagos State, they've made it very open. The first batch, they targeted old people, the indigents. Those are the first people that they targeted. Then later on, they move on to people in civil service, you know, because as a result of them not going to work, though they are getting salaries, but they still need some support. They started giving them support. Another thing Lagos did was that they did public-private partnership, whereby they brought in a lot of private sector players. They accredited them to go out and help people. In fact, Banky W was one of those that did same for some areas in Lekki. We have Food Click. We have a lot of organizations. Lagos State Subeb also, they took this further by domesticating the federal government homegrown school feeding program, where they went to communities to give food. So what's the name? So pupils that are at home, that are not able to resume to school, even though I believe that I have a reservation to that, because I believe that why do we need to give food to pupils that are not in school when you can't even do online learning for them? The one they did already was really not enough. But I know that at least we believe that Lagos should be able to prepare ahead of next year to even make sure whether there's a pandemic or no pandemic, the state is fully equipped for e-learning. So Subeb also engaged in that, and they've been quite transparent, to be very fair to them. They've been transparent. Yesterday, a board member of Subeb, that's on Mr. Dayo, was on our tweet chat, and he said they would have actually loved to do more in the area of this homegrown school feeding. But because the resources were quite limited, and Lagos as an epicenter, they are spending a lot of money in maintaining and building more isolation centers. If you listen to the governor's speech this week, the governor actually said that the isolation centers are coming up. They have the spaces are reducing from time to time, but they want people to stay safe. So in the areas of COVID-19 donations in Lagos, in the areas of the money received, in the areas of judicial spending, we've been able to see better transparency than it used to be. So I believe that going forward, we'll still keep on following. Unlike Kaduna, Lagos is yet to announce a stoppage to donation, because as I'm talking to you, Lagos is a lot of donation in the areas of isolation centers, among others. The feeding have actually stopped. Yes, they've stopped that, but a lot of people are still doing palliative little by little. But now they are concentrating more on opening up the economy, because Lagos is the economic capital of this country. You can't keep Lagos on lockdown for so long because the money is not really there to maintain the lockdown. Trying to review a lot of things that have been put in place. So the Lagos state is still receiving donation, but they've been able to make public the ones they've received before. And I know that there will still be, we are still keeping a watch on them. So if there is a change in behavioral pattern, we will surely know. But for now, Lagos state has been transparent. Thank you.
Wow, that's interesting. Thank you so much, Tosin from Lagos State. As we've heard, he said Lagos States have been able to put out updated financial record that's accessible. So just so we know, he was able to tell us that. And then, yeah, like we know, Nigeria is trying to open the economy. So attentions are now focused there, but they've really done well in putting out records. So quickly, I'm going to move to Daniel Ugu from Enugu State. So quickly tell us what's happening in your state. Daniel, please.
All right. Thank you, Stefia. Here in Enugu, actually, the state government has actually been involved in some activities. Initially, we heard that the governor actually released 350 million naira as soon as the COVID-19 pandemic, became started here in Nigeria. Even though there are conflicting reports, some news agencies were carrying 330 million, but the one written by the SSA to the governor on information was bearing 350 million. And the money was targeted at upgrading some hospitals to become full-fledged isolation and treatment centers, while some of the money were actually targeted at procuring new equipment like ambulances and PPEs and other health facilities, and also to procure drugs, for the state health sector. And about 100 million naira was reserved for what they call the emergency, in case of any emergency, any health emergency. But the challenge is that so far so good. We keep reading in the news, state officials saying the governor has upgraded so hospital, but with respect to how much has been spent on what, we don't have such information in any public domain. And that has actually been a major issue here in Enugu. You keep hearing that this has been done, but we don't know how much was actually spent, let's say, in upgrading the diagnostic center, which they have now converted into an isolation center, and also establishing an isolation center in Park Lane. We don't know how much went into that. We don't know how much went into procuring ambulances, how many ambulances were procured, and all of that. So that's actually, part of the challenges we are facing here in Enugu. And again, is that the state government, in partnership with the Ministry of Humanitarian Affairs, that's the Federal Ministry of Humanitarian Affairs, distributed palliatives to certain groups. But the challenge with the palliative sharing is that we first observed that they focused on religious groups, and they selected about 4 different religious bodies. The Catholic Diocese of Enugu and Nsukka, Anglican Diocese of Enugu and Nsukka, just very few, dioceses or few religious groups, maybe, and also the Muslim group and the Cherubim and Seraphim, and they shared, some food items to them, asked them to go and identify poor and vulnerable people who need these palliatives in their states, in the state or in their localities, but the challenge is that, from what I observed, I discovered that because what was given to them was not necessarily enough, most of these palliatives or food items that was given to these religious groups ended up being shared, maybe possibly among just very few people. And he discovered that larger percentage of them may have gone to the clergy, and to just maybe a few other members. But very many people, even in these churches, didn't actually get these palliative, and that became a problem. And also, we also discovered that the state government also gave maybe just little drops of money to different associations. Let's say for instance, the Keke Riders Association, the student groups, and a few other groups. But the challenge is that the palliatives they are giving is just such that you discover that it's just very few people who now share these palliatives among themselves, and it didn't really go round. And again, is that we also have a problem. How were they able to identify the people how do we identify the people who really need these things? There is no database, there is no, as far as I'm, to the best of my knowledge, there is no social register, with which you can say, okay, we are able to identify the demographic, the people how many people in a particular local government or in a particular ward, can we identify to be poor and vulnerable and really needed this palliative. So, you discover that at the end of the day, these palliatives, because we don't have such register, such database or such data, you realize that it also became a problem in identifying who really needs a palliative. So these palliatives ended up mostly ending up in the hands of people who may not actually be the main people who needed these palliatives. And coming to our tweet chat, which we had sometimes last week. We realized, okay, again, is that before the tweet chat, the state government was also able to maybe engage the young people, but I discovered that the engagement with the young people was basically with respect to providing security at the community levels, because Enugu being a border community to the northern part of the country, we realized that at the point, many people were coming in, even though with the interstate ban and and all of that, many people were still coming into the state from other states. So what the state governor did was to make use of young people in these communities, and they formed what they call a neighborhood watch, and they started providing security, at the borders and at their community level to make sure that, people don't gain access into the state from outside. So coming to our tweet chat, anyway, it was actually, we reached out to people we felt in the government could have information to tell us what is happening. Since we can't find this information in the public domain, I personally reached out to the special assistant to the governor on information to know if he can actually join the tweet chat to be able to provide insight into what the state government has been able to do with the 350 million they say they are donating or bringing out for COVID-19 intervention, and to give us insight, since we can't get this information in the public domain. But unfortunately, he declined, saying that he's not the right person, or he doesn't have the right information he's not the right person to actually speak. So he promised to reach out to maybe the right person, but he never really got back again after a series of engagements. So, and that actually becomes a challenge, because I was actually personally disappointed with that, because I felt that that could have been an opportunity for the state government to, be able to, tell us or tell the public, what they have been able to do, because almost everything revolves around speculations and, based on what we see in the media. And, during the Twitch chat, basically we now had to bring in other panelists, people who feel that, they are in the grassroots, we feel that they have an ear, or they know about what is going on in the state with respect to COVID-19 interventions and palliative sharing. But you discover that part of the challenge still remains that everybody, reached out to that conclusion that there is no enough information in the public space. with which we can be able to know what is going on. So basically, everything is just based on speculations and all of that. And what it now means that the state government has not been very open, has not been very transparent, and has not also been very accountable when it comes to these COVID-19 interventions. We don't even know who has donated to the state government. We don't even know if there are private individuals who have donated money, to the state government. Because even from the 350 million naira, they say that they are bringing out or they have released for COVID-19. Palliative was not part of what they say that money is meant for. So the rice they are sharing and the condiments and all of those things they are sharing, who donated it, where did the money come from? We also needed to know if there are private individuals who actually make donations to the state government. But you see, these informations are not.
Interesting conversation here. Interesting.
And not in the public space. So and that's actually all right. So in part of the recommendations we reached is that the government now needs to be more open, with respect to what they are doing, just like in other states. Like I was surprised to hear that, not surprised, but impressed to hear that the Kaduna state government is, most of this information is actually on their websites or is out in public. So which is also what the Enugu state government also needs to borrow a leaf from and also adopt such measures. So I think I may likely have to, stop here.
Thank you, Dr. Daniel. I need 5 minutes, right? But I know it's people are passionate about this topic, but we have to work with time. Thank you so much.
Yeah.
That was very interesting. I mean, that's the whole essence of the program, right? We need to make the government give us this information. They need to put it out there so that everybody can see and have access to it. Moving quickly, because we do not have time again. Guys, please, 5 minutes. Let's stick to our 5 minutes so that everyone can have their say. We'll move quickly to Ubong from Akwa Ibom. Ubong, please, it's your time. 5 minutes, please. Just tell us what is happening. If possible, if you have amounts, give us amount of how much your state have contributed so far and what's happening in your states, please. Specific, go straight to the point. Thank you so much. Over to you, Ubong.
Okay, thank you, Steffi. My name is Ubong Ekpe. I'm the state lead for Connected Development Akwa Ibom. Straight to specifics, there's been lots of demands on the government to make public how much has gotten into our state as regards COVID-19. There's been a lot of, we have in our state what is called civil society forum. We came together and we placed these demands and nothing came up until last week. The governor now just out of the blues announced that the state government has spent 1 billion naira to fight COVID-19, has spent 500 million to build a isolation center. Then he announced last week that the PCR lab has been fully constructed and is ready for use. So, but we don't have the details. Everything seemed to be done in opacity. That's for the governor. The governor had also inaugurated in our state what is called Akwa Ibom State's COVID-19 Incidents Management Committee that is headed by the SSG. So we sent letters to the SSG, Commissioner for Information, Commissioner for Health, making demands that they give us a comprehensive or at least make it public. But up till now, there's been no positive response. So we went a step further that in this narrative, we've not heard the voice of the legislature. I saw a post that our CEO, Hamzat, had placed about, I just caught a point, legislative oversight. So I now told myself, we've not really heard in our state what's the inputs of the legislature. So we took it upon ourselves to send a letter to them requesting that the Speaker of the House and the Committee Chairman on Health to exercise their legislative oversight functions and call the Incidents Management Committee to appear before the House and address these issues. There's been issues, allegations of misappropriation of the funds and lots of issues. So we were able to do that. And as at last week, the chairman of the State House Committee on Health called that everything is moving on fine. So by next week, that resolution will be passed in the State House of Assembly to call the committee members to appear. So that's on the positive side. I also sent a letter to the Accountant General making these demands, and he called me 3 days afterwards to express his inability to dispense the information that what he collects is basically funds, but the materials and the equipment is being sent directly to the incidents management committee. So he may not have the totality of the information I need. So I should get in touch with the SSG who heads the committee. So the SSG has not responded. I actually asked him, okay, since you get the funds, can we just have an idea how much, who gave who? He said he can't disclose that. We met with the Commissioner of Information. He gave us an hour in his office and we had time to discuss. So he said that he has not gotten a dime from the federal government to Akwa Ibom State to fight COVID, that he can say it any day, anytime. I was taken aback by that. Then as for the information, he said that they are still working on it, that the soonest they would make it public how much has gotten in. He had also informed us that all the construction companies in Akwa Ibom State gave 10 million naira each. So we don't know how many construction companies actually complied. Then we also got to know of the amount that UBA and Zenith Bank gave in these regards, but we still do not have a full list of what was done. Then as regards palliative, the palliative distribution wasn't too good, but at least it was better than nothing. But I just want to report an incident in a particular local government where the officials went to distribute the palliatives and some government officials were beaten up. Why? Because the individuals, the youth of the community asked these questions. We've been able to, train some of our young people back in the state. So they asked the palliative distribution team who gave what. They couldn't answer. So they had to rough up some of them. And for that particular community, they refused to get the palliative. That if they can't tell who sent the palliatives, that they won't get it. Since we are part of the Niger Delta, palliative comes from both the state government and the NDDC. So when these palliatives comes, who sends what? And NDDC is another case entirely. Nothing seems to, their activity too seems to be happening in clandestine. So we've not heard anything from them. Then there were also reports of pockets of human rights abuse. Well, the state government did well in that regard. They were able to cushion some of them, or most of them. On the positive side, they've been able to set up the isolation center, the PCR lab, the personnel. So as regards management of the COVID, I could give them a thumbs up on that. But as regards disclosure of what comes in and what leaves the states, it is very terrible. We've not had anything. Then in CSO involvement, when they had set up this incidents management committee, everyone knows the pivotal role the CSOs play in issues like this. So, but the CSOs in the state were sidelined. We were told that we don't have any essential role to play, so we were sidelined. Even the member of the Akwa Ibom State House of Assembly was also sidelined. So if there seemed to be some funny thing happening around them, but that's left for we trust that when the State House of Assembly calls them in, they'll be able to answer those questions for us. So for Akwa Ibom State, I think that's all we have for now. Gender responsiveness as regards public service delivery. I think we are above board. There's been a lot of female considerations in political appointments and all. Then service delivery, okay, there were a few incidents of women being sidelined when they went to share the palliatives. In some communities, when the palliatives were given to the council, community leaders that consist basically of men, So mean, some communities, the women were sidelined, but there were quite few incidents of that. But generally, the women were all taken along. So thank you. Legislative oversight, I've mentioned, letter sent to the Incidents Management Committee. We are waiting to hear from them. The figure now is 1 billion naira. That's what the Akwa Ibom State government has disbursed to fight COVID-19. So that's the question: how much of this 1 billion? What did you do with it? When was this money released? Then the donations, we don't know who gave what. The few ones we know about are the ones we got directly from the donors that are in your state. We gave, I think, what.
Okay, thank you so much, Ubong. I think we lost you there. Quickly, I'll just move over to Sadiq from Bronu. Sadiq, we can hear you now. Please go.
Thank you so much, Stefia. My name is Moazu Abubakar Sadiq. I'm the chapter lead of Connected Development Follow the Money here in Borno State. Actually, for us here in Borno State, with regard to the COVID-19 intervention, from the inception to date, the Borno State government have set up two major committees. That is the Pandemic Response Committee, which is being chaired by the Deputy Governor in the state, that looks at how to respond to the issues of the pandemic, especially setting up isolation centers, of which we have two major isolation centers that was set. One, a newly built hospital that was meant to be an isolation center, and another one, a newly constructed school that has not been commissioned but turned to be an isolation center. And secondly, with regard to the other committee, is the palliative distribution committee, which is being chaired by the Commissioner of Agriculture and is being with a secretary, that is the State Emergency Management Agency. For Borno State government, in terms of the response in the entire pandemic, it has been an amazing one, looking at how it's been the response to patients and many more. But with regard to the distribution of the palliative, there are one or two challenges, as you know, in distribution. This is something that has to do, like, I will align with what my colleague has just mentioned, Ubom from Akwa Ibom, where they are part of the Niger Delta. Here in Borno, we are part of the Northeast Development Commission. It happens to be that palliative distribution is also being given by the Northeast Development Commission, but it's being distributed by the state government. So it's a big kind of discrepancy in terms of knowing exactly what state government are distributing and what intervention coming from the Northeast Development Commission for citizens. And as well, it has been an issue of concern, which, despite the state have been doing quite an interesting thing in the distribution, meeting up with the demands of the vulnerable people in some of the grassroots communities, but it has not been adequately transparent in terms of showing to citizens what exactly have been spent, what exactly have been used for citizens in various locations. So, and there are a lot of concern with regard to some distribution earlier, because earlier it started as ward distribution. So ward distribution where polling units are being used to distribute this kind of palliative. So there are concerns from citizens with regard to maybe people that have membership of a specific party are being given the palliative, unlike other part of the state. So it's kind of an allegation, in so to say, in the beginning, but the committee have reviewed the process to see that they have addressed such situation, moving by themselves to move down to the ward level, to the community level, distributing this thing to vulnerable women. And one unique thing about Borno is that Borno happened to be one of the epicenters of the crisis of the Boko Haram. So we have been passing through humanitarian crisis since from the inception of, even from the inception of the inception of the COVID-19. So it has been challenging in managing people, and it has been challenging in identifying some of these vulnerable people, because I can tell you that most of the places that have been affected are vulnerable people, and the distribution have to reach such people in the grassroots. So the major thing for Borno, I can say, is lack of access to information, lack of access to information with regard to the amount being spent for the response and the amount being spent in the palliative itself. So, but for citizens, it has been an amazing one to some of the locations because distribution have been done in so many areas, in so many LGS, despite the security challenges and despite the hard to reach areas that we have here in Borno. So with regard to gender responsive issue, yes, it has been an amazing one to some extent because vulnerable women have been identified. I can say we have some of these communities, we have number of records to where vulnerable women are and where the people that need this palliative supposed to be because of our unique situation of the humanitarian intervention. And SEMA have played a vital role in identifying these vulnerable people and the stakeholders and the traditional institution in the community. But for me, I can say, despite the effort of the state government, but one major thing that we are lagging behind is lack of access to this information to be transparent for them to be more accountable in the judicious utilization of public resources in terms of the palliative intervention. Yeah. Over.
Thank you so much, Sadiq. That's very insightful. I mean, the major problem is lack of information, and that's why we would continue to push for them to release information to us. Well done, Sadiq. So our last panelist is Uzo, and Uzo is our state lead for Abuja. So over to you, Uzo. To our audience, please keep the comments coming, keep the questions coming in, and after Uzo, I'll just read through comments and then take questions, ask our panelists, and yes. Uzo, please.
All right. Good evening, everyone. I am Uzo Chukwuohanya. I am the state lead for the FCT in Follow the Money campaign. So regarding the FCT is very peculiar because it contains both the FCTA, which is the Federal Capital Territory Authority, and the federal government. So it's basically the seat of power. So there's a little bit of a mix between both the functions and the efforts of the federal government and that of the Federal Capital Territory Authority. So first of all, I was in attendance of the first phase of palliative sharing by the Federal Capital Territory Authority under AMAC. The Minister of State was present, and I must commend the authorities because they included the civil society organizations more than most other states. They were very, very welcoming to we, the CSOs. On that particular day, they shared 3,000 bags of rice and 3,000 bags of condiments to each ward. So each bag of condiment contains things like rice, oil, pepper, pepper, salt, and basically household items. So after the sharing, on that day we inspected the goods and everything was good. Everything was proper. So after that, we followed them to the center where they were sharing. That's the wards, and we saw that things were going on fine. However, there were reports from some other wards that the sharing was lopsided, that there was favoritism, there was embezzlement. But the Federal Capital Territory Minister, or rather the Minister of State for the FCTA, addressed this issue in the next meeting that we had. So there were three different distribution channels. The first one, which was one I was in attendance of, the second one was they were shared to the civil servants, that's the workers, and then the third one was like a second phase for the people, and I was also in attendance of that. On that day, the minister said that as at that time, they had distributed about 25,000 bags of rice and 25,000 bags of condiments each. So regarding the tracking of funds, we have been able to confirm that the FCT received donations of about 680 million naira. And regarding the distribution of those funds, we are sending out FOI letters to AMAC, to the FCT, and several other public institutions to confirm what the money was used for and their efforts at alleviating the COVID situation. Now, the FCT has been impressive in their handling of the corona pandemic, because a lot of places I have visited, there has been a strict enforcement of social distancing and sanitary. There have been provision of sanitary equipment and all of that. However, as regards interstate travel, because of the fact that the border between the FCT and Nasarawa states is a little bit porous, it's not properly defined. So people are able to leave the FCT through several communities in Nasarawa. So once they get out, you can go wherever you want in the north. So that is something that needs to be addressed. The National Assembly has also been able to pass the Economic Tax and Fiscal Measures Act, which basically helps to ensure that people do not lose their jobs. It basically encourages people, as employers, not to terminate the employment of their employees. So it offers tax incentives, tax relief, and all other forms of incentives to keep people in their jobs, which is very commendable. The FCT has been open to a very large extent. However, there's still always room for improvement. They can do more, which is why we're going to send out the FOI request letters. The Minister of State some time ago stated that there is a register, that they were creating a register to show all those who were beneficiaries of the palliative distribution. However, we haven't seen this register. We haven't been able to access it. So we are going to keep trying. We're going to keep lobbying for access to this information so that we can see for ourselves how many people have been beneficiaries of this palliative distribution and their names. That's to show that a verifiable form of information showing that these are the people who have received so amount of money or goods rather from the FCT. Lastly, the federal government donated 20,000 naira to about 197 households in Kwali Area Council. Considering this was under the conditional cash transfer policy, under the conditional cash transfer program. So we have been unable to follow up on this information because getting the names of the beneficiaries is very difficult. But we are still going to send an FOI request to the relevant agencies regarding this. Thank you.
Thank you so much, Uzo. So thank you so much, guys. Thank you. We'll just move straight to the comment section. Like I said, our audience, please send in your comments, your questions. This is time for question and answer. So I have a question here from Charles Uche. He said, well done, guys. Well done, Dr. Ugu. It's unfortunate Enugu isn't transparent in this regard. Please, what's the update on domestication of FOI in Enugu? Dr. Daniel, I guess this question is for you. Charles Uche wants to know the update on domestication of FOI in Enugu State.
Yeah, I know that Enugu State is one of those states that have signed up to the OGP platform, but signing up, they have not also, backed that up with the needed action, the needed action that is meeting words with, action. Because I remember that sometimes last year we sent out FOI letters to some ministries, asking some specific questions with respect to what their ministry is doing, and their budget and how much has been released from the budget for what purpose and all of that. But till today, we have not gotten a feedback. Yes, they are part of the OGP, but its domestication, there are still challenges with that. And I think that's the reason why we'll continue to, engage the relevant government stakeholders, the relevant people to see that FOI is being demonstrated in Enugu State, just like it is done in some other states that I know, especially Kaduna. I keep making reference to Kaduna.
All right, thank you so much, Dr. Daniel. Yes, we'll keep pushing, we'll keep asking government to provide this information. Please leave your comments, your questions in the comment box, and we'll definitely read it. So moving on, Florence, Basi Florence from Akwa Ibom said, as a member of Child Protection Network, we have witnessed a lot of child abuse and sexual violence during this COVID-19, and the network is really on its feet to fight back. So yes, I mean, we've had so many rape cases and other sexual violence cases. And yes, we'll continue to advocate for, the stoppage of all these. We'll keep adding our voice. Okay, I think this question is for Zeliha. Zeliha, if you are there, just unmute your mic. He said, just curious to know how the vulnerable people were identified and selected for the palliative distribution. Zaliha, are you there? So while we're waiting for Zaliha to come on, yes, Florence also said, what I also witnessed in the sharing was that people just drive into a street stop and stop at a point, started sharing food for those around at that time without any pattern of selection. Exactly, and this is just to corroborate what our state lead said. The sharing of the palliative was not, and then it was not in the open, they didn't release details of information as to how the sharing would take place and all. Yusuf Goje is saying, going forward, the advocacy should be towards demanding that every state generates a social register using community-based targeting, CBT approach, in identifying the poor and the vulnerable beneficiaries. Exactly. I mean, we should take this as a learning stage for everybody and try to do better. We should try to do better. Indeed, I agree with you. So if you're Udonfort, sorry if I did not pronounce your name well, I'm so sorry. Umoren, he said, Ubong, good job. Public availability of fiscal documents has been a problem in Akwa Ibom State. Yes, and this is just to corroborate what Ubong said. Get access to information, access to data in Akwa Ibom State was difficult, and we'll continue to push, we'll continue to ask governments to make available this information. Okay, Kingsley said, great discussions here. I would like to find out the level of inclusion of youth and the vulnerable in relief distribution in Borno, Lagos, Kaduna, Enugu, and Akwa Ibom. Okay, so Kingsley is just saying he wants to know the level of youth and vulnerable inclusion in relief distribution. So I'm going to call on Tosin to quickly address that. Tosin, please.
Can you please repeat the question?
So Kingsley wants to know, he wants to find out the level of inclusion of youth and vulnerable members in the community in relief distribution in your state.
Okay, so one thing that Lagos actually did concerning their distribution is that they stratified it. In fact, the first thing they did was to give indigents. Okay, then after indigents, they now have a special program that caters for the physically challenged and that's just the right word. The physically challenged, they partner with orphanages to give out food. So what they don't just even call them to come and queue. They go to orphanages, they give it to them. They go to where they take care of destitutes in Agege, they give it to them. They also have some physical organizations in the states, they give it to them. So they were included, and that's how they did it. So everybody was considered in the distribution process.
Interesting. Thank you so much. Yes, thank you. Ademola King is saying the issue of palliative might be watered down due to ineffective data base in our country. Believe me that data can't be used to compensate for people that collected this palliative. Well, this is what we are facing. Please let me know if you can hear me.
We all can hear you.
All right, thank you so much. Okay. All right, thank you guys. Thank you so much for tuning in. We would like to take, please, in few minutes, not even up to 5 minutes, just take seconds. Give us your last or your closing statements, please, in few minutes. Tosin, we'll start with you.
Okay. Good afternoon, everyone. It has been a very great time being on this meeting with all of you, and I want to appreciate our viewers for taking that time. Let me just say this. The greatest cure to coronavirus is to stay negative. You get it? The greatest cure for COVID-19 is to remain negative. Okay? A face mask is better than a ventilator. So keep safe, protect yourself, protect your loved ones, maintain physical distancing. I said this year is that year that death is available for nearly everyone. There is no other year that death is available for everyone other than 2020. It is now left for you to choose whether you want to die or not. Protect yourself, protect your community, stay safe from COVID-19. Together we can defeat this COVID-19, and we'll surely defeat it. I want to urge all Lagosians to support the government and obey by NCDC guidelines. We still have COVID-19 around us. In fact, the figures are increasing on a daily basis. Let's stay safe. Let's stay alive. Together, we will defeat coronavirus in Lagos State and in Nigeria. Thank you.
Thank you so much, Tosin. We'll move over to Dr. Daniel. Dr. Daniel, please, in a few seconds.
All right. Thank you, Stefia. I just wanted to say that there's one thing I omitted, which is to commend the state government for introducing a new scheme within this period, which is called the Enugu State Youth Empowerment Scheme, where they are giving free digital skills to young people, youths in the state, and actually they're actually paying for it, paying for them to get this training, and these youths, they will link them up to job in the private sector, and they will pay back while they start working, some amount to be deducted from their salary. So I think this is a very significant and very commendable, laudable project or intervention by the state government. So we must commend them. But we also want to say that our state government should become more open. They should just there's nothing wrong with becoming open and transparent. I think it's now deals with the issue of fake news and speculations and all of that, and it makes the whole process, very smooth for everyone. And I want to conclude by saying thank you to our audience for listening, and I want to say that everybody should continue to stay safe and observe all the precautionary measures that are put in place, because coronavirus is real, and it is when you are alive that is when you can actually be able to pursue whatever thing you're pursuing in life. So thank you, Stefia. Thank you for this opportunity.
Thank you so much, Dr. Daniel. Ubong, please, your last statement.
Okay. We thank you, our viewers and listeners, for giving your time in to listen up to us. Coronavirus is just an incident. We will get over it. Our development has been punctuated by this pandemic, and by the grace of God, we will ride over it. Section 14, subsection 2C, empowers every citizen of this country to ask questions. So I'm here to charge every one of us that we can stop the fleece of public funds by our government officials by asking the right questions. Don't be scared to knock on the doors. Don't be scared to raise your voice. It is our collective constitutional right to ask these questions and be heard. Thank you all. God bless you.
Thank you so much, Ubong. Sadiq from Borno State, over to you.
Thank you so much, Stefia. First of all, I would like to sincerely appreciate everyone that has been on this platform for being with us and adding their voice to the demand for transparency and accountability in government projects and government execution of the intervention. So for me, I would like to ask citizens to still continue demanding for accountability for the work government are doing because it is part of their fundamental rights and it's part of taxpayers' money are returned. So it's a very nice one sharing our experience with everyone here. Thank you.
Thank you so much, Sadiq. Zeliha, you're next.
Thank you everyone for having us. It's really nice. My last word is as young people, it's very necessary to participate in things that has to do with governance. Yes, it might not be what we all want. We might not have the platform, we've not reached there yet, but as young people, we must continue to make demands, we must continue to participate and also build our own capacity, opportunities. And also to clarify something, and probably because Tosin mentioned it, probably he misunderstood me. Kaduna State government is not stopping all donation, but Kaduna State government is saying that deductions from public service, public servants' salary, they are stopping deduction, so they won't require any deduction because public servants are also donating part of their salaries to the fight against COVID-19. So they won't be needing any funds from public servants henceforth. That's why they've allowed everybody to go back to work. So yes, young people, we must seek knowledge, we must also continue to make demand. We are not there yet, even Kaduna State with the release of funds. We still need to do more. We need the government to give us a framework, emergency procurement framework. It's very necessary. So that also we need to have list of beneficiaries. So post-COVID, if you want to have track to ensure that all these people actually benefited from the palliatives, we can easily do that. If you don't have the list of all beneficiaries, it's going to be difficult to do to ensure that there's accountability at the end of the day, because we know during the COVID, people were unable to move around and ensure that they monitor all distributions of palliatives. Thank you so much for having me, Stefia, and thank you, our listeners and viewers.
Thank you so much, Zeliha. And Uzo, quickly.
So the COVID-19 pandemic is a global health crisis, but it has presented us a unique opportunity to get our acts together. Nigeria as a country was fortunate to have avoided the Ebola crisis, but now we have seen what happens when unpreparedness meets a pandemic. We are in a form of a quagmire. So I think we as a country should ensure, we should use this opportunity to get things right, to do the right things, to make sure that such a thing doesn't happen ever again. And also the government should use this opportunity to create a register of poor people. That's those beneficiaries of the palliatives distribution should all be put and collated in a document, in a form of a registry. All the states should come together, the poor people in their states, they get their registers, they get their details, put it together, collate everything federally, and then we have a national register of poor people. So in the case of any distributions in the future, we can have a centralized document where you can make reference to make such distributions. I would urge also to follow social distancing guidelines. We should all keep safe. We should ensure that we do the right things at all time and try not to put yourself in harm's way. Thank you so much and have a good evening.
Thank you so much, Uzo. Thank you to all the panelists. You guys are awesome. Keep doing great jobs. Keep holding government accountable. And to our lovely viewers, thank you so much for tuning in. I'm sure you would agree with me that this session was insightful, was informative. Please and please, as young people, it's our duty to hold the government to account. Accountability should be everybody's watchword. I mean, they were elected to hold sensitive position. It's our duty to demand transparency and accountability from them. For coronavirus, we know the government is working tirelessly to create a vaccine for the coronavirus, but till then, the best protection, the best prevention you can give yourself is to wear your face masks, observe all the laid down rules by NCDC and other health initiatives and organizations. So we'll do ourselves good and we'll do others good if we try to protect ourselves. Thank you so much. You can reach out to Connected Development for more questions, and we are always available to answer you. Thank you so much, guys. Thank you, viewers. It was interesting. Let's do this again next time. Thank you, guys. Bye.
Bye, guys.
Thank you so
Stefia,
much.
you didn't give us
Bye, guys. I hope we're not on Facebook anymore.
Please.
No.
Alfred, are we still on?